Hello, thank you for joining us. This is a short video on specialist community public health nursing and why you should apply. My name's Dr Mandy Wagg and I'm the course leader for specialist community public health nursing here at Anglia Ruskin University, and I'm joined by Ellie. Ellie is a student health visitor based in Cambridgeshire. So Ellie, tell us a bit about your journey into health visiting. What brought you here to the course?
Well, oh guys, I mean, it's not that long a story, but I didn't start this way. So I went into adult nursing, and I qualified 5 years ago, and I knew I wanted to work in the community. I knew I wanted to work in preventative health, and that is, I mean, that's a big part of what's sort of brought me here, that kind of health promotion, public health side of things. But I went straight into the community, somehow landed myself a job doing school nursing. So that was sort of my first real insight into public health nursing. And I worked there for a little bit, but it wasn't exactly the sort of school nursing that we know now. It was a lot more just generic, helping with immunisations, things like that. And then I did a bit of safeguarding as well. And then life took me in a completely different direction, and I ended up doing travel health for 2.5 years. So a complete change, something completely different. But all the while I was applying for health visiting every single year. So it's always been in the back of my brain. But getting here, I think I needed that sort of experience to get me here. Although I definitely thought that I would be the only adult nurse. I'd be the only one with that experience and wouldn't know what I was doing. So yeah.
I'm an adult nurse as well by background before I came into this, and district nursing. We see people from all walks of life, don't we? On our course we have midwives and we have people from acute care, and it's great to hear your story as well on how you got here, because we really are accepting of different, we've got so many transferable skills is what I'm trying to say into the health visiting course. So what do you do on a daily basis? What does a health visitor do?
Oh, so many things. At this point, I mean, I'll go on what everyone does, because I'm doing a lot of observing, kind of taking part in various things. But we are one of the leaders of the Healthy Child programme. So we do 5 mandated contacts. So we see families in the antenatal period, and then we will see them again when the baby is newborn, again when they're about 6 to 12 weeks, and then we do development reviews when they're about 1 and about 2.5. So health visiting, we do a lot of those, more now face-to-face. It has been a bit more remote, but yeah, a lot of face-to-face contacts in that respect. So we'll be going into people's homes, doing health assessments, having general conversations, and providing support for parents of new parents or parents that have had multiple babies before that. And then the other side, our more targeted families that we will also work with, they might need extra support with certain things. There might be other services involved. It could be a safeguarding, it could be a development where we need to help with their development and their health, or getting early support in for them. Basically a whole host of things, but all to benefit children between the age of 0 to 5 and support parents doing that as well. I don't know if that's a good enough explanation.
Absolutely, in a nutshell. And it's such a varied role, isn't it? Such a varied role as well. Every day is different and every family is different, aren't they? And that's what's really rewarding. Any tips for people that would like to apply? Why should people apply for health visiting?
Oh gosh. Okay, so like I said earlier, the health health promotion, just that we cover so many different things, from feeding, from exercise and nutrition, from safe sleep. I mean, so many things. It's all about that information sharing and giving people the tools that they need to, it's empowering people basically, which I love. So if that's the sort of thing that you are interested in doing and you want to help the very, very youngest of the next generation, because ultimately we know that it's the most important time for all of us, and it's incredibly rewarding, and you get to spend time with families and really build relationships in a really nice in your team across the whole of the county as well. There's people from everywhere, from all walks of life with loads of expertise, and there's so many opportunities to talk to those people and learn from those people, and obviously you get to cuddle babies, which is always my driver.
Good. So you heard it here. If you want to apply for health visit and cuddle babies and just do all of that wider range of public health nursing as well, working in communities. Do you do many clinics, Ellie?
Yeah, a lot of clinics. There's definitely been a lot more with COVID, because we've been doing a lot less face-to-face actual visits, actual contacts. But yeah, we definitely do. A couple of times a week there's clinics, so they will come into the office, or we'll come to the clinic, and we'll see them for, usually it's just for weight measurements and things like that, but there are other clinics available for breastfeeding support and weaning, and there's so many things that are on offer.
Yeah, good. And what would you say to anyone nervous about coming back to academia if they haven't studied for a little while?
Oh, well, this is a difficult one, because I haven't been out of academia for that long, but I would say, and I think it's the thing that got me here is, if you're passionate enough about it and you can show that, it definitely shines through. And the academic side of things, there is so much student support, and our lecturers our lecturers have been really, I mean, they just know everything. They know everything that we need to know, and it has been really, really helpful. And I feel like for other students on the course that haven't been in academia for a lot longer, there has been that support, and there are resources available, and someone is always at the end of an email or at the end of a phone or on a Teams call just to talk you through it. And also you've got your peers as well. We all rely on each other a lot.
Yeah. So the course is quite intense, isn't it? So 1 year course with lots and lots of learning to do, and check out the modules on the website for ARU and Specialist Community Public Health Nursing. It's all on there, but we are here to support you. We want people to get through at the end. Lovely. Thanks.